Hey there, do your shins throb after your daily run or sprinting to catch the bus? It could be shin splints. You might hear the doctor use the term and call it medial tibial stress syndrome. The cause is stress of your shin bone and connective tissues. These connective tissues attach your muscles to your bone. They get inflamed and are quite painful. What's good, everybody? I'm back with another video, and in today's video I want to talk about shin splints. Shin splints is probably the #1 injury of those in the military, even those outside of the military. If you're a runner or you do any type of vigorous sport, shin splints is going to be that thing that always comes around to just annoy you. So, jumping right into it, what are shin splints? The term shin splints describes pain felt along the front of your lower leg at the shin bone. This pain concentrates in the lower leg between the knee and the ankle. Your doctor may refer to this condition as medial tibial stress syndrome. Shin splints frequently affect people who engage in moderate to heavy physical activity. You may be more likely to develop shin splints if you participate in strenuous physical activities or stop sports as in tennis, racquetball, soccer, or basketball, football, stuff like that. So you're wondering, what causes shin splints? The pain associated with shin splints results from excessive amounts of force on the bone and the tissue attaching the shin bone to the muscles surrounding it. The excessive force caused the muscles to swell and increase the pressure against the bone, leading to the pain and inflammation that you might be receiving. Shin splints can also result from stress reactions to bone fractures, the constant pounding and pounding that can cause minute cracks in the bones of the legs. The body can repair the cracks if given time to rest. However, if the body doesn't get the time to rest, the tiny cracks can result in complete fracture or stress fractures for all that matters. So, who's at risk for these shin splints? So, various activities and physical attributes can put you at risk of getting shin splints. Risk factors include anatomical abnormality, such as being flat-foot, if you will, muscle weakness in the thighs or buttocks, so meaning you are just weak, and you know, tiny heart syndrome. But I like to add that one in. Disregard that. Lack of flexibility, improper training techniques, running downhill, slack surfaces or uneven surfaces, running on hard surfaces such as concrete, using inappropriate or worn out shoes for running or working out. That is a big one. You should be switching your shoes out every so often. If you run a lot, maybe a little bit less than often. A good rule of thumb, maybe every 6 months you should switch your shoes out. Participating in sports that have fast stops and starts like soccer, downhill skiing, football and stuff, you're trying to juke somebody or cross somebody over, then you might end up getting shin splints in the long run. Shin splints are also more likely to occur when your leg muscles and tendons are just straight up tired, y'all. You know what I'm saying? Women, people with flat foot or rigid arches, athletes, military recruits, and dancers all have an increased likelihood of developing shin splints. To name a few symptoms of shin splints that you might be feeling, which is dull ache in the front part of the lower leg, pain that develops while you're exercising, pain on either side of the shin bone, just straight muscle pain, pain along the inner part of the lower leg, You can also have tenderness or soreness along the inner part of the lower leg. Also, swelling in the lower leg, usually mild if present. You can also experience numbness and weakness in your feet. I recommend you see a doctor if your shin splints don't respond to common treatment methods or remedies, which I will talk about in just a minute. If you military folks out there, go get seen. Don't try to be all extra 2 scoops of wool. Go to the TMC or wherever you need to go and get that thing seen so you can get treated. So there are some ways you can treat shin splints, some home remedies. Shin splints normally require you to take a break from physical activities and give your legs that time to rest. But we all know, especially for those that are in the military, sometimes you don't have that lull or gap in time to get the proper rest that you need. So I mean, you know, discomfort will usually resolve completely in a few hours or most in a few days with rest and limited activity. The suggested amount of downtime is typically about 2 weeks. I know I don't have 2 weeks to rest and not do whatever strenuous activity I have to do. Got it. That's okay. There's other things that can help you out as well. So during this time, you can engage in sports or activities that are less likely to cause additional harm to your legs. These activities include swimming or walking. So for those who are in the military and you're basically dealing with these shin splints, the best thing I can tell you to do, like I said previously, is go get it seen. You're gonna probably end up getting on a profile. Don't worry about it. You're trying to better yourself, get your body back to where it needs to be. Nobody's gonna, you know, look at you any type of way because you trying to get fixed. It's better to get fixed immediately than to just keep trying to run on it and end up hurting yourself in the long run. Other ways to combat shin splints, like I was saying, doctors quite often will tell you to either keep your legs elevated, use ice packs. That's going to reduce the swelling. Find cold compress if you need to. Also, you could take over-the-counter anti-inflammatories such as ibuprofen, Advil, naproxen. If you will, a trainee, for instance, you're going to want to go to the TMC and have a doctor prescribe you those medicines so you'll be in the clear. You can also wear elastic compressions, bandages. Make sure you use a foam roller to massage your shins. That's going to help tremendously roll that shin out. So you're like, how can I just avoid shin splints altogether in the first place before it even happens? So steps you can take to avoid getting shin splints is wearing shoes that fit well and offer great support. Using shock absorbing insoles, which you can find pretty much anywhere nowadays. That's going to help you out. Avoiding exercising on hard or slanted surfaces or uneven terrain. I know in AIT where I'm at, we have a track, is basically a rubber track, so it provides that cushion of shock and everything is nice and even, so that helps those soldiers out. But if you're a civilian, just adhere to what I just previously said, and that's going to help out in preventing shin splints. You can increase your exercise intensity gradually. You don't want to just jump into exercising something vigorously, especially if you're just now beginning your fitness journey. And warming up, simply warming up before you exercise, that's going to play a great factor in avoiding shin splints. And along with that warm up, you're going to want to stretch. Also engaging in strength training, specifically exercises that can build your calf muscles. That is going to also help you avoid getting shin splints. And not attempting to exercise through the pain. If your stuff is hurting, cut sling load, which meaning just stop, forget about it, and just get seen as soon as possible. Any intensive exercise program requires strengthening, of all surrounding muscle groups. So with that being said, if you train one thing, you're gonna want to train the other thing that's surrounding that particular, let's say, muscle in order for you to be 100%. Workouts should be varied to avoid overuse and trauma to any particular muscle group. So that is also a problem, not just with shin splints, but just overtraining can cause you to get injured. Anyways, y'all, I hope this quick video, maybe not so quick video, was helpful. Hopefully you can either start avoiding shin splints or you can remedy your shin splints that you already have. For those that are in the military, keep pressing on, doing what you're doing. And for the civilians out there, hopefully these help for you as well. Make sure you smash that like button, hit that subscribe button and notification bell. And remember, you only got one life, stay home, be great. Love yourselves so you can love somebody. And I'll see y'all on the next one. Peace.